Live. Ah, there we go. I unmuted my mic. So this is new for me with this StreamYard business. So I hope everybody is doing well. Pardon me if I'm kind of taken aback right now. Like I mentioned before, I've never used StreamYard in the past, so this is brand new for me. I'm not sure if we have any people who don't know me who are on this broadcast right now, but I'm Dr. Carmen Eccles. I am a board certified family medicine physician who has practiced outpatient family medicine in the Atlanta metro area for a little bit over 11 years now. And I am here today and excited to tell you all about my new book that is out. I did post the link in the description. Check it out. Get your copies. They'll make wonderful holiday gifts for your family, as I believe strongly in generational health. The book, Diabetes, What Your Physician Wants You to Know But Can't Tell You in 15 Minutes, has officially launched today. I am very excited about this and happy to let you all know about this. And I want to thank a lot of people today. Absolutely. You all know that, well, from a lot of my patients and my family members, you all know that I'm a spiritual person. I could not do any of this without God. I wouldn't be able to practice medicine. I always tell my patients, God gives me the peace, the tranquility, the wisdom, the assuredness to do what I do as your physician. So anything that I do, I'm not doing it by myself. It's through God's mercy and God's grace that I'm able to be here and to do this. I want to, of course, thank my husband who has had patience with me throughout this whole book writing process. I just recently learned from him that he felt like I needed my space, so he just gave me my space. I'm like, yo, I'm upstairs with the door closed writing this book so I could focus, but hey, it's all good. I appreciate his support throughout this process. I also want to thank Swiner Publishing, the publishers of this book as well. And Doc Swiner is also a family medicine physician in the North Carolina area. I believe it's Raleigh Durham. Raleigh Durham, Doc Swiner. Not sure if you're here now or not, but okay. But in the Raleigh Durham area, I do believe, correct me if I'm wrong, and she actually wrote the foreword to my book. I want to thank my family members who have supported me and had confidence in me throughout this book writing and throughout this journey of me being a physician. And I will say, finally, I want to thank my patients because without you all, this book, well, not even finally, I just want to thank my patients because I just thought about somebody else too. I want to thank you all for being the inspiration behind this book. As a family medicine physician, I've seen medicine change over the past 11 years. Even when I went to medical school, it looks completely different as opposed to when I first started medical school back in 2003. Yes, I just dated myself. For those of you all who want to know, Dr. Eccles, how old are you? Do the math. I just essentially told you. I went straight through with my education. Do the math. Okay. Um, it looks different. And the reason I wrote this book is that a lot of my patients have said that doctors have so little time in the room, they feel rushed. Um, do I have to take a pill? Well, the doctor just wrote this prescription for pills. I guess it's faster. Nobody told me about what I need to do in terms of diet, exercise, nothing else. I'm having this side effect from this medication. The doctor didn't tell me I could have side effects from this medication. And yeah, it's kind of the title's kind of a jab at the medical system in the way it's set up right now because we simply don't have time to explain things to our patients thoroughly. So, getting that information from my patients over the years, I'm like, you know what? I need to do something about this. So I talked to Dr. Una. Shout out to Dr. Una, because had it not been for her, you all probably would not have this book, because even though I'm a physician, imposter syndrome is real. It is real, especially when it comes to female physicians. Then you add a female physician of color on top of that. Imposter syndrome is real. So Dr. Una encouraged me to write this book because I actually felt from my patients. I felt their frustration with being rushed in and out of the exam room. I'm like, if I could just have sort of a quick and dirty, so to speak, so they can read it, be more educated, be more empowered before they go to their appointments, that would be awesome. I think a lot of people would benefit from it. So thank you, Dr. Una, for that push. And here, 5 years later, we have my first book out for purchase on Amazon, and I hope to get it available to be purchased in bookstores and other platforms as well. So I'm going to be on here for a few more minutes, just kind of chewing the fat with you all. If you have any questions, let me know, and you can just drop it in the comments. I'm just looking to see if there are any questions or any questions or comments or commentary, and it doesn't look like there are any right now. So it looks like I actually did a pretty good job with this StreamYard business. Currently up on Facebook, LinkedIn, and my YouTube account. Wasn't able to connect with Instagram, but it's all good. Not too shabby for someone who is real quick to say, look, I just diagnose and treat. Don't ask me about anything technical because I don't have any answers. I'm trying to think in terms of thinking. Another inspiration for the book, I guess, is family. The number of my family members who were diagnosed with diabetes, like my entire paternal side has dealt with diabetes and have dealt with tragic outcomes due to diabetes, including but not limited to congestive heart failure, blindness, amputations, and dialysis. My mother's side of the family, very strong family history of diabetes there as well. However, the outcomes gratefully have not been as tragic and as detrimental. And knowing that I have genetic predisposition to both, I'm not sure if some of you all know this. I know many of my patients know this because I've just kept it real with y'all. I do have type 2 diabetes, which I developed, ironically, in medical school. It is much better now through lifestyle modification and weight loss as well. Um, this was another motivation towards generational health to get the word out there and be like, look, diabetes is nothing to play with. However, it can be prevented. If for some reason you weren't able to prevent it, it absolutely can be managed. And here is a way for you to do this that I can't tell you in a 15-minute office visit. So I didn't want to put that out there as another source of inspiration for this book. So yeah, Dr. Eccles, how did you get diabetic in medical school? I studied, I was up late studying. I did not work out because my head was in the books, late night eating, not sleeping, eating because I was bored, and eating the wrong stuff because I was bored, because it tastes good and it kept me up, and gained weight. And I was diagnosed with diabetes. My, I don't remember if it was the end of my third year of medical school or beginning of my fourth year of medical school, but it was one of those kind of like right in there. So, yeah, I've had diabetes for a while. I've had it for quite a while. Nope, not on insulin, only on one medication at this time. All right. I am not seeing any more questions at this time. So I am going to shut down this broadcast. I want to encourage you all, as I said before, please, please, please get the ebook. The link is in the description box. Read it, discuss with family members over this holiday break. Get it for those that you love. And if you love yourself, get it for yourself too. All right. Happy book launch.